Hey guys, today I'll be presenting on medial epicondylitis, also known as golfer's elbow. Here's a quick image of a right arm holding a golf club, also as of the medial epicondyle of the humerus bone, which is where the injury takes place. So let me move this. First things first, what is golfer's elbow? And it is a condition that affects the tendons on the inner side of the elbow, and it involves the medial epicondyle, which is a bony prominence on the inside of the elbow where several muscles and tendons of the forearm attach. It is an overuse injury that involves a degeneration and micro-tearing of the tendons at the medial epicondyle. Now, also for a diagnosis of this injury, it will be, you have it if you have pain or tenderness when the tendon is gently pressed where it attaches to the upper arm bone over the inside of the elbow, where you have pain near the elbow when the wrist is bent downward against resistance. You also can know this if you play sports, so like baseball or golf, if you experience pain in that spot when swinging or throwing a baseball. At the anatomy of the injury, the key structures involved are the medial epicondyle, which, as I've said, is the bony prominence on the inner side of the elbow. Also important are the flexor tendons in the forearm, which are the tendons that attach to the medial epicondyle and control the flexion of the wrist and fingers. These include the flexor carpi radialis, the flexor carpi ulnaris, the palmaris longus, the flexor digitorum superficialis, and the pronator teres. In this image, you can see all of these tendons and muscles they're attached to, and this is a right arm, and where they're all located, connected to the medial epicondyle. Now looking at the pain that you will feel from this injury. The medial epicondyle is the primary site of pain and tenderness in golfer's elbow, and as I've said, that's the point where the tendons of the forearm flexors attach. In the forearm flexor muscles, the muscles which help the wrist and fingers move become strained when the tendons attached to the medial epicondyle are overstressed. The tendons themselves, which connect the flexor muscles to bone, can become inflamed, degenerated, or even torn in severe cases. And for the wrist and hand, while the pain is concentrated in the elbow, it can radiate down into the forearm, wrist, and sometimes into the hand, especially during activities that require grip strength. Looking at the anatomy of this injury still, another key component that can be affected is the MCL, which is the medial collateral ligament of the elbow. And while not the direct site of injury, this ligament supports the elbow joint and is sometimes involved in inflammation or stress. This is also known as the ulnar collateral ligament, or the UCL, which is a popular term in baseball because it is a very prominent injury where baseball players tear this ligament and have to get Tommy John surgery. Moving on into the physiology, as I've said already, this is an overuse injury. It involves degeneration and micro-tearing of the tendons at the medial epicondyle. It is due to repetitive motion or overloading of the muscles and tendons responsible for flexing the wrist and fingers, often with forceful gripping or swinging motions. As for the mechanism of the injury, tendon overuse. Repetitive motion causes small tears in the tendons, leading to inflammation, pain, and difficulty with movements. For tendon degeneration, over time, if not treated, the tendons may undergo degenerative changes where the collagen fibers break down, leading to weakening of the tendon structure. And as for increased stress on the medial epicondyle, forceful or repeated gripping, swinging, as in golf, or lifting actions put excessive strain on the muscles and tendons that attach to the medial epicondyle. Here I've provided some GIFs. To the left, we have a righty golfer swinging, and if you look at his right arm, you can see the position that is in and why it would be placing stress on the inner part of the elbow. And the same thing goes for throwing a baseball. Here we have a lefty pitcher, and you can see when the elbow is forward and the hand is back, you can see the amount of stress that places on the inner part of his elbow and why that can cause injury. Still with physiology, this is kind of just what happens with the injury. First, it's in overuse injuries. So the repetitive strain leads to micro tears in the tendons, causing the inflammation and pain. So the inflammation follows. And then in chronic cases, the tendons may undergo degenerative changes such as thickening or scarring, which is a condition referred to as tendinosis. And lastly, the pain is typically aggravated by activities that involve gripping, wrist flexion, and forearm rotation. Common tasks like lifting, swinging a racket, or even turning a doorknob can be painful. I've experienced this injury, and sometimes just like placing my hand on a desk or pushing something, I feel it in my elbow, and it can be scary. But doing my research, I learned what the injury actually is, so I know how to treat it well. Now, who is affected primarily by this? Most common in golfers and baseball players, swinging and throwing motions. The repetitive and forceful movements of these actions place significant stress on the muscles and tendons of the forearm. Tennis players and javelin throwers can be affected as well. Swinging a tennis racket and throwing a javelin are similar motions to swinging a golf club and throwing a baseball. And then people with weak shoulder and wrist muscles, because those muscles stabilize the elbow, keep it safe. Once again, here are the gifts of the golfer and the baseball thrower, so you can really see why those motions place a lot of stress on the elbow and why repeated this motion over and over can lead to this injury. Now, looking more into throwing a baseball and why it can cause this injury. Repetitive overload. During a throw, the forearm muscles contract forcefully to decelerate the arm after release, which can cause tiny tears in the tendon attachments at the medial epicondyle. Looking more at the forceful deceleration. This is the slowing down of the arm after the ball is released, which is very stressful on the elbow tendons. As for rotational stress, this involves pronation, which is the rotating of the palm downward during the throwing motion. This puts a lot of strain on the medial side of the elbow, particularly on the tendons that attach to the medial epicondyle. And lastly, baseball players throw a lot. So for high repetition, baseball pitchers and players who frequently throw are at high risk due to the cumulative repetitive strain placed on these muscles and tendons over time. Now looking at swinging a golf club, which are similar things, but for wrist flexion and rotation, the flexor muscles of the forearm are activated, particularly as the golfer grips the club and executes the swing. The powerful wrist flexion, which is the bending of the wrist inward like this, and pronation are key movements that stress the tendons attached to the medial epicondyle. There are also high forces in the follow-through, which force generated during a golf swing is transferred through the arms and wrists, placing a large load on the elbow. Similar to baseball, there's a lot of repetitive motion in swinging golf club. Golfers are swinging over and over again, so this high-intensity action over time can result in microtrauma to the tendons that attach to the medial epicondyle. And lastly, improper technique. Having improper technique in your swing, such as incorrect grip or swing mechanics, can exacerbate the stress on the elbow joint. So now, how can this injury be prevented? First, a big part is strengthening the muscles that are affected. So if you're already experiencing this injury, if something hurts, don't do it, just rest. But for these exercises, two big ones would be resisted wrist flexion and resisted wrist extension. So both of these are repetitions of flexing the wrist in one way or the other. So in these pictures, you can see one band, palm is facing upwards, and the band is pulling it down. So he's going up, and the palm is face down, pulling it down, and you extend your wrist. Here I have a GIF of each of these motions. On the left is the wrist extension using a dumbbell, and on the right, or the left is wrist flexion, and on the right is wrist extension using a weight. Another exercise would be resisted forearm pronation and supination. So you can see they're holding a light dumbbell and turning it each way, holding the weight outward so it's resisting the motion. Here's the without the dumbbell, but this is the pronation and supination that you'd be doing. Also, now stretching is a big part. So once these muscles get warmed up, it's important to stretch them in both directions in order to increase and maintain full range of motion. And lastly, technique is very important. As with most things, proper technique is highly recommended to ensure the best performance and to decrease risk of injury in any sport. I'm no coach, so I can't teach proper technique and all of this stuff, but for athletes, it's important to ensure this. Now, looking at treatment options. The first one, as it's an overuse injury, rest or time off from the cause of the injury is the most important thing, depending on the severity of it. So, for me and my personal experience with this injury, it kind of came out of nowhere, but it got to a point where throwing a baseball was painful at all times. So I had to just stop and start working on the exercises, strength training and stretching. And then, as you can see, ice to reduce the swelling that was going on in my forearm. If you have to compete, non-steroidal anti-inflammatory drugs can be useful to get rid of some of that pain. And then the biggest option is physical therapy, which usually involves the strength training and stretching options that we already went over. And then as for being medically cleared to compete, if you are suffering from this injury, being free of pain when you're participating is important, and during rest. So not even just most of the time when you warm up, some of that pain will go away, but it's important that you have no pain at all throughout the day or and just in your everyday life. So, and then also making sure that you have full range of motion in your elbow and your forearm is important. No pain anywhere, and then gradually returning to your sport will allow for the best results. You don't just want to jump back right in to where you were before you got hurt. You want to build up slowly and get healthy at a respective pace. These are my sites. Thank you.